Good morning friends. இந்த வீடியோல நாம TNPSC இன்டர்வியூக்கு தேவையான விஷயங்கள டெக்னிக்கல் ஆஸ்பெக்ட்ல ராபிடா ரிவைஸ் பண்ண போறோம். இதுல யூசுவலா புக்ல கொடுத்திருக்க நிறைய விஷயங்களை நான் எலாபரேட்டாலாம் பேசவே மாட்டேன். எது உங்களுக்கு கண்டிப்பா தெரிஞ்சிருக்கணும் அந்த மாதிரி விஷயங்கள் எது அவ்வளோ சரியா கொடுக்கப்படல அதை மட்டும் தான் நம்ம பார்ப்போம். இது டெக்னிக்கல் ஆஸ்பெக்ட்ல இருக்கும். நான் டெக்னிக்கல் ஆஸ்பெக்ட்ல அடுத்த வீடியோல நான் போடுறேன். ஸோ சப்ஸ்கிரைப் பண்ணாதவங்க சப்ஸ்கிரைப் பண்ணிடுங்க. ஸோ ஸ்ட்ரைட்டாக நம்ம வீடியோக்குள்ளே போவோம். ஸோ எல்லாமே ரொம்ப குயிக்காக பண்ணணும். ஓகே. ஸோ ஃபர்ஸ்ட் கொஸ்டின், anthrax is anthrax contagious or infectious disease? Answer, it's highly infectious but not highly contagious disease. நம்ம நிறைய படிச்சிருப்போம், பட் we don't know these small things. இதெல்லாம் கண்டிப்பாக தெரிஞ்சிருக்கணும். So next question is, what is contagious disease? Diseases that spread through physical contact with secretion, excretion or person or airborne, அதெல்லாம் contagious disease. So what is an infectious disease? Diseases caused by pathogenic microorganisms like bacteria, virus and spread directly or indirectly from one animal to another are called infectious disease. So okay, what is a zoonotic disease? A disease spread from animal to human is a zoonotic disease. What is zooanthroponosis? A disease spread from a human to animal. Example is COVID, that is important. COVID and TB or zooanthroponosis. Examples for viral zoonotic disease: rabies, SARS, MERS. Example for bacterial zoonotic disease: anthrax, brucella, salmonella, lepto. What is beta-lactamase antibiotic? Penicillin and cephalosporins. What are beta-lactamase inhibitors? That is clavonic acid, sublactam, sulbactam and tazobactam. These inhibit beta-lactamase enzyme produced by bacteria. So rapid revision data. So what is the floor space required for rapid revision data? 20 kg of grass, that is guinea grass or napier grass, or 6 to 8 kg of legume fodder is equal to 1 kg of concentrate. 1 kg of straw is equal to 4 to 5 kg of grass on dry matter basis. Maintenance requirement for the animal, that is cattle, is 2 to 3% of weight on dry matter basis. Thumb rule for feeding: for every 1 kg of 2 to 3 liters of milk, you have to feed 1 kg of concentrate. To prevent mastitis, concentrate should be fed after milking, because then only it will give time for the T sphincter to close. Otherwise, the organisms will enter through the T sphincter. So, if you feed concentrate at the end, the animal will always take the feed only by standing. So it will give time for the teat sphincter to close. So how you will calculate the body weight of the animal at the field level? It is used calculated using Schafer's formula. Weight is equal to length into girth square divided by 300. This gives weight in pounds. Okay, then how much is 1 pound? 1 pound is equal to 0.45 kg. How many animals can be maintained in a 1 acre of green fodder? 1 acre of land exclusively on green fodder. 2 animals can be maintained in 1 acre of land exclusively on green fodder. Space. Animal. Cattle requires 3.5 kg of square meter of space for every cattle. If someone asks for a pregnant cattle, you can just add 0.5 meter square. So if there is some addition like a pregnant cattle or bull, you can just add 0.5 or 1. If for bull, you can add 1. Right. For adult goat or sheep, male, it is 20 to 25 square feet. For every adult female, it is 15 to 20 square feet. Broiler, 0 to 4 weeks, you need half square feet of space. For broiler, 4 to 8 weeks, it is 1 square feet of space. For growers, 8 to 20 weeks, it is 1 to 1.5 square feet of space. For layers, it is 2 square feet of space. Now, we will go into disease. This is the first disease. I will put slides on much more diseases in the coming week. So, just will go into anthrax. I won't go deep into the disease. I will just say what you should know for the exam or interview. So anthrax caused by Bacillus anthracis, it produces two kind of toxins. One is a lethal toxin, another one is a edema toxin. In humans, it causes cutaneous anthracis and Wool-Sortus disease. Yeah, when the animal dies, you can see dark blood oozing out of the natural orifices which won't clot. Then PM lesions, you can see splenomegaly and hemorrhages in serosal surface of abdomen, thorax, epicardium and endocardium. How you have to do in case of outbreak, you have to do ring vaccination. What is ring vaccination? You have to vaccinate the animals around 8 km radius. That is important. Then on methylene on staining, you will see if you take a peripheral vein smear, you will see rod-shaped bacteria with central core blue and edges pink. And to differentiate it from anthracoids, you can see truncated edges, and this reaction of staining the core blue and the edges pink is called McFadden reaction. On culture, you can see Medusa head. Control is by notification. You have to do notification. You have to quarantine the animal and you have to dispose of the carcass and you have to remove the contaminated feed material and soil. Okay. The main important point is in case of outbreak, how will you control the disease? This is not given in any book. How will you control the disease? Especially in case of sheep and goat, in the outbreak flock, you have to administer a long-acting antibiotic and you have to carry out vaccination after 7 to 8 days. And you have to give main advice, that is you have to advise the animal owner to graze the animals in a different field because these organisms are in soil. So these sheep and goat, when they are going for, especially sheep, go for grazing, they graze very closely and these organisms get into them through oral route. So even if you are going to vaccinate the flock, you have to advise the owner to graze at a different area. Otherwise, in those areas where anthrax spores there in the soil, even if you vaccinate, the animal is has probability of dying or succumbing to the disease. So what is anthrax? Yes, this is one question that is important. Anthrax, yes. Anthrax doesn't occur continuously. It occurs in a block of years. Like it will occur for continuously for 4 years. Then it won't occur for another 2 or 3 years. Then again, it will occur for another 2 or 3 years continuously. This pattern is called as anthrax years. Okay. Thank you. Thanks for watching. Do subscribe. You will update other diseases soon. Thank you.